Next, we're going to be measuring shoulder external rotation. External rotation is simply where they bring their arm back like they're throwing a baseball. Okay? Patient's going to be C-pine. Again, you're going to be eye level with your goniometry, which you're going to measure. The patient's palm is going to be facing their feet. The fulcrum is going to be in line with the olecranon process. The proximal or stationary arm is going to be perpendicular to the floor, and the distal arm is going to be midline of the forearm going along the ulna, using the ulna styloid process as a point of reference. Okay, I'm going to stabilize her arm on the count of 3. I want you to bring your arm back for me, please. 1, 2, 3. Good. Bring it back, back, back. Okay, is that as far as you can go? Good. Normal 0 to 90. And she actually has 95. Okay. Go ahead and bring it back up. Next, we'll do internal rotation. We're going to do the same thing. This time we're going to be, I'm going to stabilize it so she doesn't rotate. I'm going to be bringing it down as far as you can. Normal 0 to 80. Again, you might want to use a little pad here. The humerus is going to be completely supported on the table. The olecranon process will be off the table. The pad will just keep your humerus in line with your acromion process. Okay, so again, palm facing your feet. Fulcrum on the olecranon process. Proximal or stationary arm is going to be perpendicular with the floor. Go ahead and bring your arm down for me. Bring it in like a scarecrow. As far as you can go. Okay, good. Okay. Using the ulnar styloid. And she has 60. She actually had a whole lot more going back. So a lot of times if you have more one way, you're going to be limited in that joint capsule going the other way. Okay, let's go ahead and do manual muscle test. Go ahead and sit up for me. External rotation manual muscle test. We're going to be putting your arm out to your side. External rotation is going to be having her push away from me, like so. She's going to be pressing away. I'm going to be pushing in. She's going to be pushing out. The muscles that we're going to be doing are the infraspinatus, teres minor, posterior deltoid. Hand 1 is going to be mid-humerus. Hand 2 is going to be distal to the ulna and radius. Okay, on the count of 3. 1, 2, 3. Push, 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 push. Good. And again, 5 out of 5 because she could handle max resistance without breaking. Okay. Internal rotation is going to be the opposite. We're going to be doing subscapularis, teres major, anterior deltoid. This time what we're going to be doing, I'll be stabilizing, but I'm going to go in the inside of her arm. On the count of 3, I'm going to push you away. I want you to try and touch your tummy. Ready? 1, 2, 3. Push, 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 push. Good. As I'm doing this, externally and internally, I'm also trying to stabilize her elbow to the side of her body to keep it close in so she's not trying to compensate and come out. Okay? Good. Huh?
So yeah, I did that.
Yeah.
It's okay. It's okay though.
Stop.